There's a secret world just outside the hospital walls where clinicians trade stethoscopes for startups. If you've ever wondered how someone goes from seeing patients to building the future of healthcare, you're in the right place. I'm Kayla, a PA on a mission to figure out what comes next. When I started researching careers in health tech, I found confusing job titles and zero clarity on how clinicians actually made the transition. So I went straight to the source, the people who already did it. Each week, we demystify a specific career path by someone who's already living it, whether it's from the bedside to the boardroom, the startup, or something completely different. Whether you're planning your exit, passively curious, or already working in health tech, this is your insider's guide. Welcome to corporate espionage. Sweet. And listeners, today I'm so excited to introduce you to Meredith Hickerson. She began her nursing career as a surgical ICU nurse, managing the sickest patients at the University of Kansas Health System. Then she took a contract role at a health tech startup in 2018 and answered the question, does a nurse really belong in a SaaS company? She validated the answer is yes. Then she built an entire patient navigation department from scratch. She grew it to 6 team members with zero turnover in 5 years while managing care for over 100,000 patients. Now she's the lead clinical consultant, spearheading AI-driven clinical implementations and wearing many, many different hats. I'm really excited to have you today, Meredith. The journey that you've been on is so valuable to listen to and really inspiring. So can't wait to have you share your story and give us a little bit more insight into why you care so much about this. I love it.
Thank you. Yes, thank you. I'm happy to be here, Kayla. Thanks for having me.
Absolutely. So let's get right into it. I'd love for you to share more about your nursing journey, what that experience was like for you, what kind of nursing you did, why you loved it, why you hated it,
Yeah.
and kind of bring us along that journey with you.
Okay. I'd love to share. So, first, thanks to all your listeners for caring about my story, and thank you for Kayla for giving me a platform to talk to you guys. So, my nursing journey started, like you said, in the surgical ICU at a large academic level 1 trauma center, um, 20-bed ICU. Took care of very sick patients, multi-system trauma patients, multi-system surgical patients, septic patients, all the like best types of ICU patients. I loved it so much. And I was so fortunate to start my career there. I worked with incredible nurses who I still look up to today. Um, Really amazing clinical nurse specialists, 2 of them, Linnell Pierce and Mindy Stites, incredible women who have really driven a lot of innovation in critical care nursing. So I had them to kind of look up to and guide me. And their leadership helped me get into being a unit educator for the surgical ICU. So that was a great experience because I was able to take on a leadership role at a fairly young age, early into my career. Somebody once told me I was a, what do you call it? Like an early success or early high achiever or something like that, which I hate repeating, but I felt that in myself because I had a desire to like do more than be at the bedside, even though I loved it. I really did. I'm kind of one of those people I didn't get jaded right away because I loved the challenge and I loved taking care of patients and even giving them a bath. I just loved that part of my job and just really taking care of them and knowing every part of their history and their inpatient stay. Um, so when I took on the challenge of being a unit educator again, it gave me a lot of good experience with leadership, um, quality initiatives, driving educational change throughout the department or throughout the division, excuse me, and hospital-wide initiatives. So that was really good for me professionally. Um, and then I actually left that role temporarily to go work for my region's organ procurement organization. So I very briefly did a stint as an organ procurement coordinator, but I very quickly learned that I couldn't do that job because I was pregnant at the time with my first child. And, it was one of those professional moments where you had to decide like family or what I wanted to do. And I wanted to kind of keep with the critical care patient, but it was just not for me. Sadly, it's great organization, incredible people doing incredible things for donor patients and recipients. So I went back to the University of Kansas Hospital and worked post anesthesia. So I still got, the critical care aspect. And that's kind of what led me down the path to health tech, very surprisingly. So rather than, seeking out health tech opportunities, I didn't even know that was a thing back in 2018. Like, no, it wasn't on my radar at all. I just knew like, oh, we have Epic, we have an EMR. I didn't know there was a whole kind of opportunity for tech beyond that outside of like nursing informatics, which I was like, what does that even mean? That sounds so boring.
Yeah.
Um, and so I actually met the founder of the company where I work now, and he's okay with me sharing this, so that he was a patient of mine. And I remember him being like, what? How do I hire a nurse? I need to hire a nurse. My board wants me to hire a nurse. I'm like, I don't know. Go to LinkedIn. Like, I'm just trying to do
Oh
my
my
job. I was
gosh.
totally like dismissive of it and just like, focused on my job. And I was talking to some of my coworkers after the fact, and they're like, you should really reach out to him because he gave me his business card. And I was like, nah, I don't know. It's kind of weird. And so they really pressured me into it. And I'm so grateful that they did. And so I ended up emailing him and I was like, hey, remember me? I was your nurse. And like it was like a month or so later. And he emailed me right back, like, yes, I actually remember you. Come to the office, let's meet. So I was fortunate because it's a local company to where I live. So I was able to go to the office and I was really interested in what they were building. And I was like, sure, why not? I'll do something new. I was really craving something new and a challenge at the time. But again,
Yeah.
I just had my first child. So I was like, I can't take on too much new stuff. I need to like learn how to be a mom and a working mom. Um, so I ended up just doing some consulting work for them, which I didn't even know it was consulting work at the time. I just kind of so I took it as like, I'm just learning. I'm just here kind of seeing what you guys are doing. If I can provide any valuable impact, I'm happy to. But it actually turned into like I was doing work, not
Yeah.
just like consulting. I was actually like producing things for them. And what that
Can
meant
I
was, yeah,
can I interject? Can you say more
please.
about like what that really meant for this company?
Yes. Yeah. So for this company, and it's, I still work there. It's, uh, the problem we solve is the follow-up problem. So how do you do that? Well, the follow-up problem we're trying to solve is any kind of finding within a radiology report that requires some kind of follow-up, whether it be a consult, surveillance imaging, maybe they need to have a surgical consult, whatever it might be, a biopsy. Um, so what our very first disease to get up off the ground was aortic aneurysms, and really the reason that was chosen was because the um, CMO at the time was like, this is a problem I see in my practice as a vascular surgeon. I need these identified and I need to know which patients we've lost. And
Yeah.
so I worked very closely with him, which was also great because it was like two clinicians getting together and like doing something. So I learned all about the process of like collecting a high quality data set and then what do you do with that? I didn't go build the machine learning algorithms, but I helped curate the high quality data set, and the amount of foresight that has to go into that and the volume that has to go into that in terms of the data set is extensive. And so it was a huge amount of work, but it taught me so much about the disease and why data quality is so important in healthcare and data quality in general, but specifically for healthcare when we're trying to find patients, take care of patients, you want the highest quality of data. And I'll speak to more of that here in a little bit because think that's something that we don't really think about as clinicians at the bedside. You're actually producing data that can be used, long term for future tech developments, which is really
Yep.
cool. So all the data input that you do as a nurse at the bedside, you maybe have never considered it as data input, but it is. So it can be used for good things down the road. If you've never thought of it that way, it's kind of a different perspective. So anyways, that's when I first worked for the company, that was kind of my focus is like doing that and kind of understanding the one client that they had at the time that was leveraging that software. Then like how are they doing it? Where are their fail points? Again, it was like what do we do once we identify patients? In this particular hospital that was the first client, it was like, hey, here's your patient list and then what? It's like you need structure, then you need to understand best practices, standardize the process. And that's what I ultimately helped develop, but I didn't know that that was going to be what I was going to do at the time.
Sure.
Um,
Yeah.
and that's why I referenced the two clinical nurse specialists that I worked with early on in my career. Clinical nurse specialists are So amazing. They do so much good stuff, and I feel like they totally fly under the radar because they're like that personality type, like, doesn't need recognition. They're just like, "I'm gonna get stuff done." I love CNSs so much. But I kind of called upon their style, and how I wanted to, like, move forward with the company and, like, how I would approach solving the problem of implementing, operationalizing patient surveillance program that's software driven. It's you can kind of change the lens of the company and say, is this a is this a technical company or a clinical company that's tech enabled? And like, of course, as a clinician, I'm going to say, well, we're a clinical company. We're taking care of patients.
Yeah.
And so I've kind of been able to help bridge that for our customers. So that was early on in my days, and I'm still there. So I've been with the company now for it's been over 7 years, which is really crazy to say, and in the startup world, that's really
That's a
unheard
long
of.
time. That's a long time. I feel
Yeah.
like even, I don't know, in modern day like work culture, that's a long
Yeah.
time.
Yep, it is, and so sometimes I think, "Hmm, something wrong with me, or is this a good thing?" I don't know, but, you're
Yeah,
figuring that out, like, you just have to remind yourself, like, no one knows what they're doing. Everyone's just figuring it out every single day,
yeah,
so whenever I question that in myself, I'm like, "Ah, this is just my journey. It's fine."
totally. I mean,
And
I
I'm
think it
enjoying
speaks
it.
a lot to how much you enjoy the work that you do, number one,
Yeah.
and the culture of the company and like the integrity of the company and the work that you're doing, you know?
Yep. Yep, totally.
I'm interested to hear more about what specifically you admired and like what qualities you were drawing from the CNSs that you had mentioned.
Yeah, I think just always being curious and, like, never thinking that they knew the answer, It was like they never had the solution. They saw a problem and wanted to learn more about the problem and figure out a way to help fix it. And ultimately, you know, clinicians are such problem solvers, and they are, like, the best at that. So I love that about CNSs and the 2 that I referenced. They never assumed they knew the answer, and, like, ego behind them. Like, "I'm gonna go direct to the source. I'm gonna go to, those on the front line and learn about the problem and know everything about it, and then start understanding how we can solution this." Um, Always evidence-based, always looking at what kind of research is out there. Um, those are probably like the core things, are like curiosity, problem solving, evidence-based kind of mentality. Those are the things that I loved. And they're always like nurse first. Like we are doing this to improve patient care. And if improving the life of a nurse is what it is, then that's going to improve patient care. So they just are amazing people. And if you know a CNS, give them a high five. They're so great.
Yeah. So, okay, so you then took that approach when you kind of furthered your discussion with the company, which is
Yep.
called Illuminate, if I'm not
Correct.
mistaken.
That's correct.
Illuminate, as you sort of discussed potentially coming on as a full-time role.
Yeah, yep. That's right. So I did like a year and a half or so of consulting while I still worked full time at the hospital, which if you ever get an opportunity like that, highly recommend taking it. You might feel a little stretched thin, but like it's totally a great way to learn, even if you're not going to do anything full time with that company. Just learning and getting exposed to as much as you can is a great opportunity. So I'm very grateful I did that. And for me, yeah, it did turn into a full time opportunity. Um, and even when that was being discussed, I had my own doubts of like, do you really need a nurse? Like, I don't know. Like, I didn't know. But as I did it more and understood, no, you can't just enable tech and identify a bunch of patients and then just hand it over to a hospital and say, good luck. It's
Yeah.
not good for the company, first of all, because you're not going to drive success. You can't just assume that any clinician is going to know how to take a program, a follow-up program, and know how to run it successfully and in maintenance mode to where you're producing outcomes, identifying those outcomes, and providing data analytics on them. I mean, there's so many things that benefit the company, but then on the healthcare system side of things, like if you've invested in a product, you want to know how to use it. Um, and our product at Illuminate is you identify patients in real time and historically who need some kind of follow-up. And again, you can't just flip that on and say, good luck. We'll see you later. We'll help support the app. Like that's not what it's about. We have to help integrate processes, establish processes, take the knowledge that we know, um, and share with other institutions so that we can drive outcomes. And when we say outcomes, it's not just to benefit us as a company, it's to say, oh, you're taking care of patients,
Right.
which is so huge, and retaining patients in health systems, which is important long term when you're talking about contract renewals. Like, yeah, you've retained patients because of this program. You're going to want to renew our contract because you're just going
Right.
to lose them again. Um, so with all that being said, I I then saw the need. The more I interacted with that very first customer, I was like, oh yeah, this nurse needs help. She can't do this alone. She has little support on her side, not because the health system was terrible. Everyone's spread thin. We all know that in healthcare. It was
Yep.
nobody really knew what to do with it. So I took that opportunity, that time before I even came on full time. I got to know that nurse and understand what she's doing. And I started to see what I considered gaps in her processes. And again, not because she was doing something negligent, but it was because she didn't have the support from a medical director perspective, and an administrative perspective on her side um, to prioritize the project first of all. Other work was taking priority, and also, you know, standardized communication pathways with both patients and providers in getting buy-in for the program, things like that. So as I started to understand those things, I just started documenting it, like documented the heck out of it. I just had like all these files of notes and ideas, and a lot of them I trashed. It's like these ideas aren't good, but at least I'm getting
Hmm.
something on paper. I love a Lucid diagram. Before I used Lucid, I used Visio. Love a Visio. And I would just like put process maps on paper to try to start mapping out how we were going to do this. And then I started reviewing the patients that she was reviewing and putting myself in her shoes and saying, okay, if I came across this, what
Mm.
would I do? Or
Hmm.
this is a false positive. This patient shouldn't be identified. And then do we need to take that back to our data quality and start changing how we're doing things on the identification side? Um, or this is a patient that should be identified, yeah, but they're super low acuity. So like we need a protocol in place that allows the nurse to work independently, where she's not so dependent on like a medical director reviewing things, or if, or uh, a physician or APP reviewing something. Like the nurse should be independent. And so those are the kind of things that I observed very early on, that helped me ultimately build the processes that we built to operationalize our programs.
And it sounds like you really validated your role as a nurse when you saw that, like, this nurse wasn't succeeding without
Yeah.
you.
Right, exactly. And so we had always been kind of toying with the idea of like, could we provide navigation services? Could we do that remotely on behalf of health systems? And I'll be honest, when I first started, that was kind of in the talks, but I was such a doubter. I was like, I don't think so. How are you going to do that? Like I know
Yeah.
there's like contract nurses, but like how can you possibly remotely manage thousands of patients? Like I don't understand it. But man, I was proven wrong, and partially from myself. I proved myself wrong, and on our team who did the first few clients, like we did it, and it was so satisfying. And it took a lot of iterations. I mean, we didn't get it right the first time. A lot of painful conversations.
Yeah.
Um, a lot of trudging through. The ambiguity of that, but once we did, it was like we got it down. Like I've got files, like I could do it in my sleep getting these things implemented.
Yeah.
Now that we've firmed up the processes, it's all about getting something reproducible, reliable, and of high quality. And that's what we've done. It's been really exciting.
Yeah. Can you talk me through the navigation system?
Yes.
When I imagine this product being rolled out, I would imagine number one, patient gets identified.
Hmm.
Like step two, we reach out to the patient, we try to get
Yep.
them follow up. Step
Yep.
three, then we make sure that they actually show up for their follow up, and then we kind of
Exactly.
follow them on an ongoing basis.
Yep.
Is there anything? What am I missing?
Yep, you got it. So it sounds so simple, but it depends on the disease you're identifying. Well, we
Yeah.
do, we oversimplify, but there's it depends on the disease, first of all. So we have very targeted algorithms that can identify very specific diseases like abdominal aortic aneurysm, cerebral aneurysm, pulmonary nodules, like very specific things that go to a specific um, specialty department. We also have very broad, like general radiology finding programs, which is a whole other kind of workflow. But when you when you think about identifying patients that have any kind of descriptions, I'll just use the example of an aneurysm because it's fairly straightforward. Um, when you identify an aortic aneurysm, now what? Does the patient need follow-up now, or do they need
Right.
follow-up in 10 years? And those workflows look very different. The
Sure.
last thing you want to do is contact a patient, have them freak out because they hear the word aneurysm, and Google says that they're at risk of,
You're gonna
sudden
die.
death.
Yeah.
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 And so it's 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 talking through, hey, we know we'll identify these types of patients. We need to know how to hone in on that list. We don't want to throw them all out. We don't want to say we're going to exclude these patients. We just need uh, a protocol in which nurses can work under as independently as possible. So if I have a patient who has a teeny tiny abdominal aneurysm identified yesterday, they don't need anything for 10 years, but we still know something, so we should tell someone, right? Typically, some medical directors say, no, don't tell anyone, just keep them under surveillance, which we could do, but we like to notify patients to, educate them, get their get their buy-in that they need to continue to take care of themselves, and then they do need to return for follow-up. Not to say, you've got this scary thing, you have to come back now. It's, hey, you have this, take care of your heart, stop smoking, those sorts of things. So we have to set up communication pathways that say, I'll talk to their provider first, and then I'm going to give that provider a week to talk to their patient. If they don't and they want to offload that to us, happy to talk to the patient. We'll let them know. So that's kind of one side of it. And then it's the patients that are kind of on the cusp of, do they need a referral? And then that's a whole other process. So are we going to pin referrals to providers as kind of like a white glove service? Hey, Dr. Smith, your
Right.
patient's meeting referral criteria. We didn't see that. You knew about this aneurysm that was identified in the ED last week. They need to be seen. And again, it's notifying that physician or APP first, and then giving them an opportunity to speak to their patient, especially if they have an established relationship. And then fortunately, our app is built in such a way that it allows for this kind of reminders, not, you think about reminders in the EMR and things can get just lost in the abyss of the EMR. It's
Yeah.
not meant for longitudinal surveillance of patients, whereas our app fortunately is, so we can manage thousands of patients. So then a week goes by, then I'm notified, oh yeah, I need to call this patient now and let them know, and then help with getting that patient over to scheduling and get them scheduled. Um, so yeah, it all sounds really simple, but when you do it for the first time and you're calling a patient to say, hey, you had an aneurysm that was identified 7 years ago, no one told you about it, you really need to be seen. This thing was on the cusp of being big then, and AAAs grow about half a centimeter every year, and more. If you're the bigger it is, the faster it expands. So, you can do calculations to say, oh man, I think this thing's reaching operative level before you call the patient. So it's all those sorts of things of like standardizing your communications and getting the medical director and institution sign off that yes, you can represent our institution with this types of communications, and talk to our patients this way, and so on. Doing it of quality and doing it with good productivity. So that's another thing we want is we know we're going to be tracking tons of patients, thousands of
Hmm.
patients. So we want our nurses to be efficient. And that's where I kind of got into working with product, and our engineering team is like, we need our nurses to be more efficient. This app needs to be better. And
Right.
this is what I'm observing. I'm an end user. So my feedback is invaluable. And that's such a gift that we have at my company, as our end users are also in-house. And I
Yes.
see the engineers from where I sit, and I just give them my eye, like, I'm coming for you, you know? And I'm so fortunate to have that level of communication and connection with that team, because we can directly influence it. So that kind of got into like, once I started doing the work myself, it really gave me new lenses on how product can be influenced, which I've really enjoyed.
Can you talk more about that? How you feel like clinicians and nurses, even specifically, are like kind of uniquely positioned to influence products relating to healthcare?
Oh yeah, yeah, totally.
Would you like
So
a pedestal?
yeah, please, here I am. So where do I even get started? The funniest thing ever is when a new version gets rolled out and there's a new button. You're like, why is this button here? What does this do? Oh, I didn't ask for this button. I don't need this button. Why was time spent on this button?
Sure.
You didn't ask a clinician. That's why an engineer came up with this idea and didn't validate it with anyone. It just made, I have to laugh at it and not like cry because it's just the only way to look at it without losing your mind. And we all see that. We all see that and even when you're using, Microsoft products like Word, you're like, I don't need this. This isn't my workflow and how to use the app. It's the same thing in healthcare. But yeah, clinicians are so uniquely positioned because we know the things that we're running into and we know what needs to happen to get the work done. And I don't want to be held up by buttons and clicks and mouse movements. I want to be fast and efficient. We're all so busy. And so the only way you do that is by walking in those shoes. Um, the thing that I've had to really learn over the years is how to communicate with engineering. I might have the idea, but if I can't articulate it, nothing's going to happen with it. And so that's something that I've found myself kind of being a chameleon when I'm talking to either engineers or data scientists is like kind of getting into their brain of like this is how I know this is their common language, so I'm going to use it. And that's been successful for me in translating requirements for features and big features that really impact the end user's experience.
Are
Um,
those things that you picked up on over time, or you like specifically researched, or how was that discovery process happening?
Yeah, that's a great question. So when I very first started, I tried Googling. Like I was like, what are these things they're saying? Like I didn't even know what an HL7 was. Like I didn't know anything. I just like really was like basically a nurse off the streets. And they they didn't have any kind of expectation on me to know any of it, which was really nice of them at the
Yeah.
time.
Yeah.
And I kind of was like, yeah, I don't need to know. I'm gonna not participate in this part of the meeting. But then very quickly, I'm like, no, this is not. I can't do that. That nothing good will happen if I don't speak
Right.
up. And
Right.
our CMO was like so good at like digging in. Like he would always double click. Like, wait a second, that doesn't sound right. And I've learned so much from him to like not that you're doubting, but you want to know more because what they're saying, what you're hearing them say isn't what they are saying. And so really confirming you're not speaking two different languages is important to always double click when you're talking to someone who's non-clinician, very technical heavy. I've learned that. Um, but yeah, to answer your question, I tried the whole like, I'm going to just self-educate on independently. And I wasn't successful at it. Granted, that was several years ago. I know there's tons more out there now, you know, Gen AI and you can go to Chat GPT and learn a lot.
Right.
But
Help me talk to my engineer 101. Lesson one
exactly.
today.
Exactly. But I just listened and asked a ton of questions. I took every opportunity I could to ask a question, maybe not right in the moment, but after I'd pull somebody aside and be like, what does that mean? Um, and once I started hearing words more frequently, that's when I would like Google something and like understand like what that means, like just interfaces and things like that, like understanding how the two, systems can communicate. All the interoperability stuff is so important. And all these health tech vendors that you hear about, they have to have interoperability with EMRs, and that's how they're existing as a company. And so, learning more about that really helped me with just being okay with participating in like IT calls, even though I wasn't necessarily contributing to the call. Listening in is so important, and just always being curious has helped me a lot. Um, and it's just taken a lot of experience, a lot of frustrating conversations, to be honest, because it's sometimes so hard. It's so hard to learn new things, and it's so hard to understand their language and how they're talking about databases and infrastructure that you don't see in the UI
Yeah.
of any app, but
Yep.
exists. And there's always a why. Why can't we do this now, or why can't we do this ever? It's because there's certain things that we don't know about as clinicians in the background that make the whole thing stand up.
Yep.
And that's really helped. It's helped reduce my frustration when I really want things now, as an end user, but also understand like there's a process that has to take place in order to really develop tech that is of really good quality. Um,
Yeah.
and man, it's a lot. It's amazing. I don't ever want to be a software engineer, but wow, I am so impressed. They're very smart, very smart people.
Yeah. So I'm hearing a lot of the way that you're approaching the situation and like every single conversation really is with a genuine curiosity, which it
Yeah.
sounds like, I mean, that's how you even landed yourself in this role, just because you were curious. And that's a quality that you
Hmm.
brought to like your educator roles,
Yeah.
your roles on the
Yep.
unit. Like you seem like someone who leans in, and says like, oh yeah, it's okay that I don't know everything about this. Like,
Yeah.
I'm still going to try and learn as much as I can so that I can be the best, person that I can be in this role.
Yeah.
And also like asking questions along the same
Hmm.
vein of curiosity rather than
Hmm.
just, again, turning inward, doing your own kind of research,
Hmm.
being like an active participant in things that might be over your head, yet
Yes.
you are willing to
Right.
try your best, right?
Yep.
And
Yep.
face some of that friction along the way.
For sure. And I think it's so important to like not assume that you should have a solution. Like, don't if somebody asks you a question and you don't know the answer, like it's okay to not know the answer. Somebody would rather you say, I don't know, this is what I'm thinking.
Yeah.
So you can have a discussion about it rather than speak to something you don't know and end up being wrong and that, losing trust in that person or something. I kind of vague, but it's like you don't ever want to be that person that assumes that they know always.
Yeah.
And
When I
I
think about when
Mhm.
I think about clinicians who are trying to kind of lean into technical roles
Yeah.
or non-technical roles in the tech space, I
Yep.
think a lot about imposter syndrome,
Yes.
because we know our world very, very well.
Hmm.
And I think that a way that maybe we try to get ourselves in the door easier or kind of fit into the culture more is by pretending that we know things that we don't know. Like
Yeah.
it's the same thing that we do when your friend is talking about a movie that like you haven't really seen, but you want to be able to laugh with them. So you're like, oh yeah, I remember that
Yeah.
scene
Yeah.
for sure.
Totally.
But
Totally.
I think that there is like a humility that's lost in planting your feet firmly in what you don't know. I
Hmm.
remember back in the day in training, right, in like my rotations, I was always, always, always was drilled into my head to never say that you knew something that
Yeah.
you didn't, but
Right.
instead to say, I had never thought about that before, or actually, I don't know, but let me get back to you after I do
Hmm.
some research.
Hmm.
So,
Yep.
very fresh kind of perspective and a great reminder for clinicians who might be trying to lean into these types of roles.
For sure. And it's so hard to not have that imposter syndrome. And I think if you're looking at a health tech role, you don't have to like say, "Oh, I perfectly fit that role," or "I definitely don't, I can't apply." It's not that. It's just evaluating the points in the job description because descriptions can be very vague, but
Mm-hmm.
you have to be really creative to think like, "I do have experience that could meet that." And I'll give you an example. So there's so many roles, like there's so many customer success roles, right? They're everywhere. They're everywhere. But that is a very vast term. It's a very large umbrella in my experience of what that actually means company to company. But one thing they have in common, at least in my observation, is reviewing data and finding trends within data and finding, an area for opportunity or looking at utilization metrics or productivity. I mean, there's so many things that you can look at through data, so many things. But when you think about it as a clinician, like I said earlier, you're entering data, right? You're tracking data. You're looking at lab trends. You're looking at vitals trends. You are evaluating data every single day, whether it be a very specific lab that you're tracking. You're tracking a lactate. You're trending, ABGs and pH, whatever, or
Mm-hmm.
you're tracking, patients, broader metadata, and you're, monitoring symptoms over time for aortic stenosis. Is the patient now getting symptomatic? Like, there's so many things that you are tracking from a data analytics perspective. You're just not thinking of your patient as data, but they are. So, just kind of something that you can be creative about when you're looking at these roles and understanding how your skills do translate. I've learned they
Yeah,
have.
right. Like applying a different lens of thinking about
Yeah.
things.
Yeah,
Um,
totally.
do you know Lauren Curtis, who runs Hey Health Tech?
No, I don't.
She just put out actually a really great, I forget whether it was a in her newsletter, but it was like a way to reevaluate your skill set and almost like
Yeah.
look at it with a lens of product or program
Mhm.
manager or like whatever, or
Mm.
customer success, like
Yep.
how you can reframe what you do on a day-to-day basis in the
Right.
language of the role that you might be going for. I will find that and I will put it in the show notes. I'm
Great.
99% that sure that it is Lauren's.
That
Yeah.
sounds great. That sounds like a great resource, and
Yes.
it's just, I mean, just what you described, it's like spot on. Everyone, you have the skills to do a non-clinician job, even if it's not in tech, honestly, even if it's just,
Yeah.
if it's a business kind of corporate role, like those skills exist. And critical thinking and autonomy, problem solving, like all those are there. You just have to call upon them. Think about those specific experience and communication. Oh my gosh. Well, that's what we do all day every day, not only with patients but multidisciplinary teams. That's what you do when you take care of patients, and that those skills absolutely translate. So
Yeah. So, I loved that little overview. I want to focus back on your journey with Illuminate because
yeah.
you not only, grew this navigation program, but then
Hmm.
you also grew a team and you hired on other nurses.
Yeah.
So you
Yep.
really switched more into like a managerial role as well.
Yeah. So yeah, I was the first nurse hired at the company, and we got to a point where it was like, oh, we actually have enough business. We think we need another nurse. And it's like, great. I was so excited to have another nurse at the company. I was so excited. I was like, I work with all these engineers. I need another clinician voice. It can be really hard to serve as a clinician voice because you have to be able to, like I said earlier, translate the clinician world to a tech-minded or business-minded individual, and that can be really hard. Um, and so having another nurse kind of support me in that, I was so excited about. So
Yeah.
we hired our first nurse after me, and she's amazing. She's so great. She's an incredibly hard worker, so smart. Just she's like the get shit done person that you want. And she's just killing it. She manages like over 7,000 patients by herself right now. She's amazing.
Oh my
Anyways,
God.
yeah, she's great. So we hired her and brought her on, and that process taught me a lot in not only finding like a good candidate and like good skills that you want, and good just like interpersonal skills and proper background, all those things. It also taught me how you want to onboard somebody, and it quickly shows you the gaps that you have. So I didn't have any onboarding really. Like I was just like, I just came on. I just kind of figured it out. Just I was okay with that, ambiguity, so much ambiguity, but I didn't want that for the next person. I wanted them to come on and feel like warmly welcome, and that they had their access to everything like as close to day one as possible. So there wasn't this kind of like disjointed onboarding. And I definitely didn't do it perfectly, for sure not. But it was like, it was such a good learning opportunity for me to, make sure we set our nurses up for success. And then her and I really partnered together to actually operationalize how we do remote navigation. Um, and as we kind of both grew in our individual roles, that's where it kind of like I naturally took more of the like customer facing side of it. And she was like plugged in getting shit done like she does. Kind of more like a um, tell me what to do and I'll do it follower type of personality. And she totally admits this, so I'm not dogging on her. We need both to make the world go around. And then I kind of took on more of that leadership side of things, again, client facing, operationalization of things. Um, and then we hired another nurse, over a year after that, I would say. Same thing, like great background, great personality, fit in really well with the team. It felt like a natural fit. And she's also still kicking it, getting shit done, being awesome. Um, and then as time continued on, I continued to like kind of go off this way and take on more than our navigators plugged in. They were
Okay.
navigators plugged in doing work. And then because of my longevity prior to those two nurses coming on, I had my hands in so many other buckets that I couldn't get my hand out of. And I didn't want to. I mean, I enjoyed those things. So what
Sure.
are those other buckets? They were things like sales support. They were things like working with our data science team. There are things like product, like I mentioned, and then there's the whole aspect of like implementation and client management, what some organizations might call client success. Some institutions, differentiate between like implementation and client success, but for us, it's still one. Um, and so I still to this day straddle each of those departments, in addition to the nurse navigation team. So I continue to kind of take on more and be spread a little bit more thin. And then actually, the start of this year, we formally hired a navigation manager who's managing that team now. And it's allowed me to pull back from actual navigation duties and just be like full on in those other things that I described. So the sales
Sure.
support, product, data science, kind of anything strategic we're doing as a company, any new like a new disease that we're developing and getting kind of started for the first time. And then of course I saw all my lovely clients. So I still manage all of our clients who don't use our navigation because it's optional. We like when our customers use our navigation because we find it to be really successful. But I still manage those clients too and help make sure they're driving to success, that we're delivering value in presenting them with that value. So clients might think that they're getting value,
Right.
but if they don't really know it, you're not
Right.
feeding it to them, then like they're not going to know it. And so that's
Yep.
something that I've really learned a lot about too, is, how do you articulate value that your product and solutions are offering, which is, again, a lot of creativity you can have with that. And I think being, you know, a clinician at the bedside is that you have a lot of creativity and some ambiguity with what you do. It's not always by protocol. So that I think um, has helped me too, to be able to look at some data and say like, oh, I know what this is saying, and somebody in a business hat wouldn't know it. And so I have to call it out. And so some of those things that I've been able to call out in our analytics has been how we've built our narrative as a company. So how we say we improve retention. Well, we wouldn't know that if we hadn't started identifying that data point within our
Right.
the patients. And so I was able to do that. And it's been so rewarding to like be able to share narratives with our customers and just general marketing that we wouldn't have had otherwise if I hadn't like called it out specifically within our data
Yeah.
and built reports around it. So again, being a clinician has helped me find that and being able to share it and articulate it. So
Yeah, you actually truly know what the value prop is from
right,
the customer side. Yep.
exactly,
And
exactly.
the customer in the lens of the patient side.
Yeah, exactly. And you have to think like there's value, there's there's kind of different value lenses you could look at any health tech product. It's what's the end user's experience, what's that value, but what is going to make the people who sign the check. What do they consider to be valuable?
Yep.
Um, and when you have a solution that's like pretty straightforward, like okay, the ambient scribe, like we get it, we get what that is. It doesn't take a lot of explaining to somebody who's non-clinical, or somebody who would maybe sign a check who's non-clinical, but for something that's real niche and heavy clinical, being able to tell that story and do so with data is really hard, and do it succinctly. You don't want to be like, oh, I need an
Yeah.
hour meeting and I'm going to spend the whole time explaining why we're here. It's like, no, these people are busy. So getting it down pat and telling the story with data is so important. Um, and I'll give you an example just because I feel like it's kind of vague how I'm describing it. But um, so for Illuminate, for our products, like we identify patients who need follow up. So once those patients are identified, do they come back for care? Some of them don't need to come back right away. Some of them need to come back in 10 years. But we want to be able to say, like, these are the patients that they're not going to receive care at your institution. They're closed out of the program, but your institution is receiving value of these patients because these are patients who have risk mitigated. These patients otherwise would not have heard about this finding if it weren't for us in this program.
Right.
And that can be in the order of thousands of people, thousands. And maybe they go on and get their operation, their biopsy, their subsequent care at a different institution. Maybe they live out of town, whatever. They live in a competitive healthcare, landscape in a big city, it still it's improving the trust that that patient has with your institution, to know that they have your back with some kind of technology. And so developing that narrative with data was critical. And it's a no-brainer. Once you hear that's like that took me less than 30 seconds to say, but you get it. And it's in a and somebody and an administrator would get that too. They want their health system to have patients trust them.
Trust. Yep.
Yeah, and that trust ultimately can turn into a retained patient. Hello, somebody in a
1000%.
CFO position is going to say like, "Yeah, I want to retain a patient." They're going to come back for
Yep.
other things. Like that's great. So that's something that I've developed in being able to look at data and know what's important. And I think part of it takes getting to know the product that you're servicing too, what data is possible. But then also what data are we ingesting from that institution? What data do we have access to that we can leverage to tell the story? Again, a data analyst who's not doesn't have a clinical background or an engineer, they don't know what data to pull. We do.
Yep.
So I can say, go look at these referrals to this department and see the status of them. Are they closed? Are they open? What are they canceled? And understand what's happening.
Totally.
Um, Another example of that is like I was able to find in one of our clients that their referrals for a specialty were all going external. Why were they going external? Because the EMR was defaulting it to an external referral. Like, that's crazy.
Woof.
They didn't even know that. They didn't that institution didn't even know that. And it was like this because we saw a problem with patients going out rather than being retained with the data. And then I was like, well, why? Let's double click into it. And so I asked our data analyst to go find additional data. That's what was happening. These referrals were defaulting to go external. Like that's
Nobody
nuts.
wants that. Nobody
No,
wants that.
nobody wants that. So the little things like that, gosh, it's just like again, you need to know, you need to have been in an EMR, spent time in an EMR to know
For
how things
sure.
work and where the gaps are. So
Yeah.
it's been fun. It's really fun it's a different lens of problem solving. It's not just problem solving. I'm Jimmy rigging this suction tubing to make sure it's, you know,
Yeah.
still getting gravity, whatever. But it's still fun. It's exciting to be able to prove something with data.
Absolutely. I was also just thinking that there might be listeners who either are non-clinical or who have never worked in a setting where they come up with incidental findings. So I just wanted to overview, like
Yes.
even in the emergency room or the urgent care setting, the
Mm-hmm.
settings that I have experience in, sometimes you get a test and the radiologist will literally write incidental finding
Mm-hmm.
and define what that is. So that could
Mm-hmm.
be a liver mass or a liver nodule. It could be a pulmonary nodule in their lung. It could be an abdominal aortic aneurysm that
Yep.
is, couple maybe half of a centimeter above what it should be,
Mm-hmm.
and that needs attention. It could be, I mean, I've seen like seemingly benign bone masses identified on
Yeah.
X-rays in the urgent care,
Yes.
and I can do my part, especially in an outpatient urgent care setting or in an ER before I send the patient home to say, hey, by the way, maybe mostly not a big deal today, but they did find this thing on your scan. I print out the report for them, I highlight it for
Yep.
them, and I highlight the part where the radiologist is like, repeat in 3 months recommended, or like
Mm-hmm.
CT scan within 1 month
Yep.
recommended. And I
You,
mean, in
you got
in
it.
the urgent care setting, like I've had some pretty serious incidentals found
Oh
where the
yeah, I believe it.
radiologist is like ASAP follow-up CT.
Mhm.
And if that doesn't need to be sent to the ER, you send this person home with a page printed out where you're telling them to do something. Like
Yep.
the reality of it is they might not even know what you mean. They might
Absolutely.
not know what that means
Mhm.
at all. They might not have any implication that that could have
Yep.
seriously, deleterious effects on their
Mhm.
health.
Mhm.
Um, and
Absolutely.
there is a huge gap in the ability to ensure that these people actually get the referral care that they need. So
Right.
that's where this solution comes in.
Yes. Yep. You got it. And you're absolutely right. It's the radiologists love radiologists. Nothing against them. They're busy too. It may not even get to the impression, which hello, and a
Yeah,
physician APP in the clinic, they don't have time to read the full report. Sometimes these reports are so long. And and if it doesn't make it to the impression, then it might not ever get the follow-up.
very
And
true.
it's I mean, I've seen massive aneurysms, lung masses not mentioned in the impression. Patients never told, or yeah, like to your point, they are told, but they don't know. They don't know. They throw that thing away. It's in their car under their seat. They don't look at it. So yeah, I would say especially the ED incidental findings. It's a challenge. It's such a challenge. I don't think that's really going away without a firm solution around it. Like
Yeah.
it is the nature of an emergency room that patients need to be seen quickly and that a lot of them need imaging. That's just what
Yep.
we do. And imaging is going to find stuff. And sometimes it's things that get people worked up and it's not worth it, but other times it's something that really needs to be found. And as we know, there's so many screening programs, um, you know, lung cancer screening, that AAA screening that don't get completed. Like the adherence rates are super low. And so programs like an incidental findings program essentially take place of screening in these patients. There
Right.
may be patients who, for AAA, for the example, who meet screening criteria, have never been screened, but they were in the ER, past the age of 65 and they had a CT. Let's count that as their screening. Don't bring them in for another screening. There's ways to improve these things beyond just incidental findings. Like and that's a really good example for AAAs. Doesn't work so much the
Yeah.
same for lung cancer screening because those
Sure.
patients need to be screened annually. But still, it's like if I'm a lung cancer screening patient and I've never been screened and I have a nodule, I need to get closer follow-up and then enroll in a screening program. So now it's that again, that health system's opportunity to retain a patient. Not only is it taking good care of the
Yeah.
patient, but it's better for the health system because they've retained a patient and it helps the business side of things. So yeah,
Totally.
it's just such a big problem, and I love solving it. It's really fun.
The other nurses that are on your team, is there a common thread in their background?
Yes, there is. All of us are former critical care nurses,
Of
actually.
course you are. Of course
Yeah,
you are.
um, definitely. I would say we tend to be more like, um, just like anal about stuff, just want to get stuff done. We're more type A.
Yep.
I would say that my personality is more like I I see a problem, I want to be creative with it and solve it. And that's where I kind of made the distinction between our nurse navigators who are plugged in, like hyper focused, they're so good at it, and where I kind of take things at a different level and like figure out how we can operationalize something. What's the workflow behind this? How can we document it and make it repeatable?
Yeah.
And that's how we scale the business because we want to implement fast so um, we can see that, hit FPU and see the revenue and go on to the next and do it well so our customers are happy and referenceable. So that's been a huge part of what I've done in my time at Illuminate is like how we implement. Um,
Can I be a beginner really quick and ask you
yes,
to define FPU?
yes, FPU is first productive use. So
Ooh.
any SaaS company, so software as a service, they typically get to bill once they hit FPU. That is like, we've done everything on our side. Now you guys can go do your work with it. So that's generally, you'll hear FPU as a really important date to hit. And oftentimes you'll want it, before the end of the quarter kind of thing, because then you can close that business within that quarter. So a lot of times you'll hear those types of things. And again, phrases I had no idea existed where
Yeah.
I lived it and was in it and hearing these things. And it kind of you asking about that, it makes me think of these, the engineering terms and like immersing myself in engineering tech conversations. I've had to do the same with business conversations, like immerse
Hmm.
myself in what the sales process is like, and what's commonplace to see, and what are sales cycles, and how long do they take, and why do they take so long? Why is the contract with legal? Like all these things. What's a lead versus you know, lead to signature and what that time frame looks like and what are all the different categories of a sales opportunity within there. I've learned a lot along the way, especially because I mentioned earlier I do sales support. So
Right.
that's something I really love. If that's probably I really like that part of my job because it's so fun to like get on a call and like demystify what we do and like do it with the clinician's lens because a lot of times, salespeople aren't, they often are clinicians, but they're not always. And so
Right.
They're so good. They're so good at what they do. And they'll even say, like, you're a clinician, they just get it from you better. They just have a different level of trust with you. And so being able to come in and just like describe what we do very succinctly, um, this is how we do it. Here's an exact example of why we're doing this. And it's just like it just gets buy-in so much better. Um, I think. I love it. It's so fun to like demystify what we do and
Mm-hmm.
just like see their faces change when you're talking about what you do. So I've enjoyed that. And part of that's doing demos, like doing a good demo of your product. Um, that is a skill that is very much developed. And I've learned that it's not something everyone is good at or wants to do. I just so happen to like it, and I've been told I'm good at it. So again, I hate saying that about myself, but it's you have being able to present something and do so with like smooth click movements and not saying I click here, just really guiding somebody through a story of how the product works. Takes a lot of practice, and a lot of companies will have like scripting and make it real standard. But you always want to be prepared to like go off the cuff and like
Right.
solve a really specific problem that prospective customer is having.
Yeah. Lots of learning.
Yeah, so much learning.
I think that this might be a good time to transition to sort of our final aspect of the conversation, which
Sure.
is I'd love to hear from you your thoughts on exploring avenues as someone who is currently a clinician.
Hmm.
What do you think clinicians should have their eyes open for? What
Yeah.
are the aspects of maybe their clinical careers that have gone unturned that they can peek under and see how they can grow and develop before they kind of dive deeper into the world of health tech?
Yeah.
And yeah, just general kind of wisdom from
Yeah.
where you stand now.
So I would say the first thing, like if you're listening to this, I think you're doing one of the first best things, which is just like being informed and like having that curiosity that I think is so important. Just seeing what opportunities are out there is good. That's like the first step. Knowing that you're never stuck in a role if you're not liking it is very freeing. Nothing is permanent. So that's the first thing. In terms of like looking for roles, I don't know if this is right, but this is my perspective. When you look at it like a health tech company, very generally you have these different departments. You're going to have sales, you're going to have engineering, product, the data science is in with that. You'll have data analytics, again, all kind of within that umbrella. Um, so and product is in there, and I call that out because that a clinician can do product. Then you're going to have like implementation where things like project management can come into play, and implementations can kind of bleed into like the customer success kind of realm. So those are all very common roles that you'll see these companies post or have people on their team that fulfill these roles. Um, and then it's kind of like, well, what do I want to do? You might not know what you want to do. You might not know where your skills best fit, and that's okay. I would just get to know a lot of job descriptions, which I'm sure your listeners are doing if they're listening to this podcast. I'm sure they've looked through hundreds of job descriptions because I know I have. It's helped me understand like what I could do beyond what I do now,
Right.
and know where my skills are transferable. I have the advantage of having the background that I have and wearing a lot of different hats and knowing each of these different kind of pathways. Um, but if you like people and you're good at having tough conversations, and you like looking at data and telling those stories and things, like that might be a good path for you to go to like the customer success route. Like maybe, right? You might not really want to be involved with people. If you're more tactical, you're really like checklist focused and you like checking something and seeing it done and moving on and like kind of being a lead, like PM might be an option for you. You might want to be more in that PM role. Um, but if you're like a go-getter and like hyper competitive, like go sales, like just look at those roles. I think that's so awesome. Um, and then product manager, I do very commonly requires experience and knowing those tech terms and like owning a product roadmap is like not without a lot of stress and takes experience, in my opinion, just knowing what I know about what takes to go into the product roadmap and having that foresight. Um, my personal view is that it's a stressful job. People who have been product managers, I'm like, oh, I've been there, I wear the hat, I've moved, got the t-shirt, I've moved on. Like that's no big deal. But I'm like, I don't know, it seems kind of stressful to me because you're like defining what's happening with the product.
Mm-hmm.
Um, so my best advice for that route is like that would be I think, I'm not saying I'm right. I think getting in with a company and understanding the product and then understanding if that's something you want to do, I think is a good route. I would have
Sure.
I think it'd be really hard to get into product management without experience in product management. And so how do you get experience with product management? I think it's just getting your foot in the door with the company. Um, so in order to get your foot in with a company, I'm not an expert, but what I think is the best thing to do is really hone in on a specific problem that you're interested in solving. So if you have your eyes on like, a handful of tech companies that you really admire, getting to know that problem really well and building up your skill set in that problem will help. So an example of that may be like if you look up Cohere, 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 they're huge, huge health tech company, and they do hire nurses. And that would be a way to get your foot in the door, but really like getting to know their problems. So like, utilization review as an example, like getting kind of experience in that within your health system now would be very transferable to get you in the door and not only meet more people, but understand the inner workings of their tech, and seeing if you could like eventually move departments. Something like that I think is really good. CDI, same thing, like really getting to know CDI, clinical documentation integrity, as a clinician. There's tons of solutions out there, and that's not going away. So you can get that skill set and then transfer it to a health tech company. That would be my advice, is to kind of focus in on the problem that's being solved by those companies that you admire and getting
Yep.
skilled up in that area.
That's such great advice. I really love the route of consulting
Hmm.
turning into a kind of a full-time gig. But
Yep.
I also think, just like you said, that you can almost spin that to also mean like I still wore my clinical hat, but I joined, I don't know, a CDI board,
Yeah,
or I
exactly.
started a CDI, program within
Hmm.
my company, or
Hmm.
I took classes to learn more about the utilization review and,
Hmm.
supported my team in this or my
Yep.
unit in this. I
Yep.
think that those are very, um, overlooked commonly strategies to
Hmm.
build more. And like, you also then you're not, completely and totally pivoting and like throwing yourself in the deep end of something.
Right.
You actually can explore and build those reps and build up your not only credibility, but like your confidence,
Right.
and your skill set that you truly bring.
Yep, absolutely. And the other thing that I would recommend, this would just even if you're, ultimately staying within a health system, is getting published and like doing poster presentations. Like you don't have to lead it necessarily, but if you can get in on something at your organization, again, this is where the CNSs are so helpful because they that's what they do. They research and they solve problems. So getting to know people like that, there's practice councils and there's things that you sound like, ugh, it's just like an extra thing. Like, yeah, it is, but it can open
Yeah.
the doors to other people within your institution who are interested in doing a poster presentation at a big conference, whether it be, NTI or the Magnet Conference or health. I mean, there's tons of stuff you can do where you can have a poster presentation, and then it just adds to your credibility of like, I'm serious, I'm professional, and I know a
Yeah.
lot about this thing.
Yep.
Um, so I would recommend that. I think that's always, good solid advice. Um, and again, I'm no expert. I still have a lot of career left, but these are things that I've found helpful as I've, met people and, interviewed for jobs throughout the years and been successful in my role now. And being able to call upon those experiences when you're talking to like a client, for example, just builds up your credibility and trust with them to make that relationship successful too. So it benefits everyone in the long run.
Yep.
Yeah.
Well, may not think that you are an expert, but your experience and your view on things and your ability to articulate those things are so valuable. It's also really valuable that like you're not, 30, 40 years into your career, having the
Hmm.
perspective of someone who really has quite recently walked this path is
Yeah.
so high value for people who are kind of like looking from the outside in, or maybe
Hmm.
even thinking to change directions that they're moving already within the non-clinical world.
Yeah.
Those are some really, really practical strategies to change and grow and move horizontally or vertically wherever they're wanting to.
Yeah.
So thank you.
Absolutely. Yeah. Thank you for having me. This has been really fun.
Yes. All right. Well, let's wrap it up. So, if the listeners want to get in touch with you, if they want to learn more about what you're doing or what Illuminate is doing,
Yeah.
how can they get in touch with you?
LinkedIn's the best place. Find me on LinkedIn.
Perfect. Awesome.
You'll see some posts about like cool patient stories of that we found and have taken care of, had great outcomes from, and just like my view in general and like the importance of surveillance. I'm like really honed in on that, obviously, because you can tell from this
Yeah.
conversation. But LinkedIn's a great place. I'd be happy to connect with anyone, meet new people, and just support everyone on their endeavors in their careers. So, Kayla, you have been supportive in that for me. And I've met so many amazing clinicians in kind of the health tech space who are very supportive, not like competitive and like, I'm
Yeah.
not going to introduce you to this person. Like, everyone's been so wonderful. It's a great community. And I will just say one thing about LinkedIn because, LinkedIn can be a very overwhelming place. I would
For
just
sure.
encourage everyone to have a really like healthy relationship with it. And I need to take my own advice here, but don't feel like it's this just like monster land of competition of people. Like
Mm,
it doesn't have to be like that. You don't have to find a role. If you're interested in getting into health tech, you don't have to find a role in the next 3 to 6 months. It's probably going to take some time. Just like correct expectations with yourself, and it'll only make your outlook and your mindset healthier on it. And I think make you happier the day to day as you wait to hear back on an application or whatever it may be. It's a tough job market, period. And also like LinkedIn can be such an overwhelming place. Um, but there are like real humans behind accounts like me and
right?
Kayla. So we're
Yes.
nice and we'll support you. So that's just like a teeny little soapbox on
Yep.
LinkedIn and just really social media in general.
I was gonna say it's kind of crazy that the sort of social media imposter syndrome, like comparing yourself and feeling inadequate, is also extended to LinkedIn. Like that's
Yes.
crazy.
It is crazy. It's so
Yeah.
silly. It shouldn't be that way. But there are people who are supportive and want to see you successful and just don't expect it overnight is what I would say. Just take your time, do things here and there. Those little things that you're doing, like what we described as like getting it, building up your skill set, like that'll take time and it'll compound. And a year, 2, 3, 4, 5 years from now, you'll be really impressed with yourself. So
Yeah. Without a doubt. Those are fantastic, fantastic reminders. Thank you again. Listeners, if you want to get in touch with me, I will put my LinkedIn in the show notes as well. And my Instagram is at its.kla, like Kla or Kayla dot
Mhm.
B. Again, thanks for tuning in to another episode of Corporate Espionage. If you are a clinician who sees yourself in this conversation and you are doing some really fantastic, non-traditional things in the healthcare world, I'd love to hear from you and I'd love to share your story. So feel free to reach out and stay tuned next week for another episode and have a great weekend.
Thanks, Kayla.
Thanks, y'all. Of
Bye.
course. Thanks, Meredith.